has had a dramatic increase in incidence in the last few years. There are many thoughts as to why that has occurred. The most prevalent thought is that there's an increase of type 2 diabetes, which has resulted in a higher incidence of pancreatic cancer. Most, 2/3 I should say, of the patients who develop pancreatic cancer develop it in the head of the pancreas, which is the most difficult area to operate on because of the major blood vessels that go through here. And consequently, pancreatic cancer has had a very poor outcome, and surgery for pancreatic cancer has had a very notorious poor outcome. The most common operation we perform for pancreatic cancer is called the Whipple Operation, or pancreatic duodenectomy. In that operation, we take out part of 4 organs. We take out the head of the pancreas, the part of the stomach, distal bile duct, and duodenum. What's made this operation so difficult and complex is that you have major blood vessels to the liver and the intestine going through here. What has made this operation, I think, very successful recently is liver transplantation. Through the lessons we've learned from liver transplantation, in which we reconstruct these blood vessels, we've been able to take patients that may be considered non-resectable in the past and can resect them because we can take out these blood vessels and reconstruct them. I've been doing liver transplants for over 30 years now, and the lessons I've learned from that I think can really be applied to the treatment of pancreatic cancer. Here at Sherman, where I've been now for 5.5 years, I think because of the lessons learned from liver transplantation, most of the patients we take to surgery we've been able to resect. We have many different modalities available to help us, such as replacing the blood vessels. We have a technique called irreversible electroporation, where we can actually shock the tumor around the blood vessels to allow us to resect these patients and consequently have good outcomes. The only cure for pancreatic cancer is surgical resection. It is still a surgical disease, and up to recently only about 15% of patients could be resected. Here at Sherman we're well over 50%, and our survival is very good. And there are some complications, but usually these are self-limited, and patients recover from those complications and go on to lead a very high-quality life.